I'm here with Mr. Lockwood. Mr. Lockwood, where do you live?
Austin, Texas.
Austin, Texas. Okay. Now, how'd you pick us to come see us out here in Midland?
Well, you were recommended by my wife because you did surgery on her mother and my mother-in-law and also her brother-in-law.
Okay.
And they spoke very highly of you.
Oh, good.
And also I wanted a third opinion.
Okay. So you'd seen some other doctors in Austin, correct?
Yes, I've seen 2 neurosurgeons, two separate times, about 4 years apart.
Okay, so you've seen 2 neurosurgeons about the same problem, correct?
That's correct.
What did they tell you?
They wanted to fuse 3 vertebraes. They wanted to fuse 5, 4, and 3.
Okay.
Both of them.
They're going to put bolts and screws and all that stuff in there?
I honestly don't know what they were going to do. I just know they were going to fuse those 3 vertebrae.
Okay. Were you going to spend several days in the hospital, or did they tell you about that?
Yeah, several days in the hospital. I think it was 6 weeks, something like that, without driving a car, something or another.
Okay. So, coming to see us, we're going to try a small surgery on you, and we're going to do your surgery, go home that day. And I guess that's more appealing. That's more...
Yes, that's exactly. I wasn't ready mentally. I didn't feel like for the fusions. I was still in pain management, I guess you'd call it. And I wanted to, hopefully that technology would come along or something would come along that I wouldn't have to be that invasive in my surgery.
Sure.
And I came here and you told me, without knowing that I'd been to the other 2 surgeons, you told me exactly what I wanted to hear, and that's why I'm here now.
Okay. Well, we're going to do your surgery, and I'll talk to you again after surgery, okay?
Great.
I'm here with Mr. Lockwood. You had surgery 2 days ago.
Yes, correct.
Okay. And number 1, did this help your leg and buttocks pain?
Absolutely.
Okay.
It's relieved the pain in both my legs and, of course, the buttocks going down completely, 100%.
Okay. You have some back pain where you had your surgery, correct?
Yes, I do.
Okay. Is that pretty much well controlled with your medicine if you take it?
Yes. Yeah.
Okay.
Yeah. It helps to take it.
If after you had surgery that day, went home that day?
Yes, I did.
Okay.
Went to HEB that night.
Walked around the day of surgery
Correct.
at HEB?
Yes, I did.
Okay. Last night, how much did you walk yesterday?
I walked around about a 3-block radius.
Okay, so that's one day after surgery, you walked about 3 blocks. Okay. And before surgery, how did you have to walk before surgery?
Well, humped over.
Okay.
It's the
Show me how you had to walk before surgery.
The basket scenario, it's still habit to lean over like this, even after surgery. It's just habit, but I have to lean like this and walk. But now I can stand up and lean backwards where I couldn't do that before without excruciating pain. I could do that, but it was painful all down both legs. But now I have no pain at all, none whatsoever.
Sure. So, and what I think is important is for patients coming in from, say, like you, coming in from Austin. Has this been difficult to come here and get taken care of?
No, you've made it quite easy. I mean, as far as you got me into the MRI the same day that the office visit was there, but no, it hasn't been difficult at all.
Okay.
And the coming in today instead of waiting till next week has made that easier?
Sure.
Not at all.
So what we're going to do is we're going to see you your 2 days post-op. You're going to see me today, and then you're going to go back to Austin tomorrow. Is that the plan?
Tomorrow, I believe. Yes.
Okay. And then what we're going to do is we'll just follow up with you and say probably about a week or so just to see how you're doing.
Okay.
I'm not going to make you come back and see me unless you just want to. You're welcome to come back and see me. Love to see you, but you don't have to come back and see me.
Okay, well, next time we come to Midland, her mother's in Midland, we'll make an appointment with you and check in.
Perfect.
Yeah.
But don't feel like you have to. And you have my cell phone, so if there's a problem, you know how to get a hold of me.
Great.
Okay, there's no stitches to take out, there's no staples to take out, there's just a little bandage back there and some tape back there, and that should just come off with time.
Oh, okay. Just let it come off when it's supposed to. Okay,
yes, sir.
Great.
Okay, any questions for me?
No, I'm quite satisfied.
Okay, well, good.
Very much so.
All right, thanks, I appreciate it.